Senator Kaine.
Thank you, Mr. Chair, and I want to again express my appreciation to both Senators Alexander and Senator Murray for these hearings. Healthcare is the most important expenditure anybody ever makes with $1 in their pocket. There's not one that's more important. And I think the stakes are existential for us to get this right because, frankly, the last 8 months, the American public has just been assaulted with words like repeal, implode, sabotage. This government is scaring people to death about the most important expenditure that they're ever going to make in their life. If we had had a discussion about the future of the Affordable Care Act with the administration just committing, but we're going to continue to make the cost-sharing payments, we're not going to upset the apple cart while you're having discussion, people still would have been concerned. But the combination of a discussion about repeal with an administration that, frankly, has rooted for an implosion has got people very, very frightened in the most important area in their life. You are holding these hearings so that Congress can try to step up and be an Article I branch again. Not an Article II.5 branch reacting to something that the President does, but an Article I branch. And as important as health care is, there's an even bigger existential stake. I think the American public has to see that Democrats and Republicans can work together to solve their problems. They have to see that. An administration praying for implosion isn't showing them that. They've got to see from Congress that in the most important expenditure anybody makes in their life, we are willing to work together as Democrats and Republicans to solve problems. I see this committee as a, I'm not going to say last hope, but after many, many months, if we don't get it right, if we can't find common cause, even if it's in modest ways about this most important area, I don't see anybody else doing it. And so I think the stakes are very, very, very high for us. I wish my colleague, Dr. Cassidy, Senator Cassidy, was here because he pointed out I'm not trying to do something partisan, and I agree with him. The proposal that he and Senator Graham has is not intended to be a partisan proposal, but it's pursuing a process that unfortunately is very, very partisan. Because trying to come up with a bill to get through the narrow budget reconciliation goal and pass with 51 votes, and having no language about the bill, we still don't have it, and trying to force it through on a snap vote in 2 weeks without being able to adequately consider it. And I'm reading articles about its negative effect on Virginia. I'm glad that my colleague today said it was going to help Virginia. All the published articles say it's going to hurt my state. You cannot fix health care just with one party. You cannot fix health care with just some snap vote with language that nobody has seen. So the process that we are underway here on, where we are hearing from experts, you're the third panel, Democrats and Republicans, to tell us what works, what doesn't work, and what needs to be fixed, is the only way that we're going to be able to address this most serious issue. It's not going to be through tweets. It's not going to be through a snap vote. It's going to be through earnest people with differences of opinion, listening to experts, and then engaging in the hard work of listening to each other and crafting compromise. And you've committed to this, and that's why we're here. And I don't mean to put even more pressure on my chair and ranking, but the stakes couldn't be higher. They could not be higher.